Welcome back, everybody. It's my pleasure to introduce our platinum vendor, Gestalt Diagnostics. Gestalt Diagnostics transforms pathology through an intelligent, configurable, and vendor-neutral digital workflow that provides true interoperability, enabling pathologists to diagnose diseases faster and more efficiently. And giving the talk is also my pleasure to introduce Lisa-Jean Clifford, who is the COO and Chief Strategy Officer of Gestalt Diagnostics. And she also is a member of API's PI Summit Planning Committee and the PI Summit Topic Review Committee. So she wears many hats at API. Her talk is titled ROI or Benefits. How do you measure the successful implementation of digital pathology and AI? So I'll leave the floor to you, Lisa.
Excellent. Thanks, Dr. Joe. I appreciate it. Thank you, everyone, for joining us today. I'm hoping that the session is an informative one for you, and please feel free to ask questions at the end. So when we talk about a measurement of success, we typically think of businesses and what the key categories are to be able to determine success within an organization. And depending on the hat that you wear and the role that you're in within an organization, there can be a variety of different factors that you use to measure that success. But some of the more common ones and more consistent ones across an organization are obviously financial. So determining an organization's financial health is extremely important. And that can be measured in a variety of ways, whether that's revenue or profit or a combination of the two. The number of customers certainly can determine the strength of an organization, and the level of customer satisfaction is extremely important. Having customers, but customers who are unhappy is never a good measure of success for an organization. Employee satisfaction, and this is a key one, especially in today's employment climate. It's very important to have employee satisfaction, and really one of the main reasons for that is for retaining that knowledge base and that value within an organization that employees bring. Pipeline is another measurement of success. So sales opportunities. What are the opportunities that are in an organization's pipeline that will enable it to grow and sustain its revenue streams? Here's one that's often overlooked, though, and it's measurement against goals and benchmarks. And this is really important for an organization when they're measuring things that are not necessarily tied to hard dollar measurements. So things like operational efficiency and organizational aptitude are things that you can measure against goals and benchmarks. And that's important to keep in mind when you're deploying new technologies as well. So when we look at healthcare entities and laboratories, they are certainly a business. We don't always think of them as a business because they're a business with a higher purpose. And obviously that higher purpose is patient care and patient outcomes. But they are certainly a business. So financial health is a certain measurement for success within an organization. And you'll see on the right-hand side here, I'm starting to attribute two symbols. One is a dollar sign, and that's where I am relating that directly to actual hard dollars. And that can either be cost savings or that can be revenue generating. And then there's the ETA symbols, and that is where I'm looking at operational efficiencies, gains, and benefits. So when we look at number of customers as it relates to laboratories specifically, we can be looking at outreach customers and we can be looking at patients, because patients are a consumer of our services. Level of customer satisfaction. Now, this can be measured in everything from turnaround times, which many laboratories have contractual obligations to their customers for turnaround times, but also in terms of accuracy. And turnaround times and accuracy are not only important to your external customers in terms of other healthcare facilities and laboratories, and physician groups, but also to patients. Again, employee satisfaction. So there are hard dollars associated with employee satisfaction when we're talking about, again, things like, the great quit and the silent exodus that we hear and read a lot about right now. So retaining and maintaining employees, obviously doing that is much less expensive than having to recruit, hire, and retrain or train new employees and bring them up to speed for the knowledge that's lost when you lose an existing employee. Pipeline opportunities, and then again, measurement against goals, benchmarks, and operational efficiencies. And some of these are dual benefits and actual hard dollar ROIs. When we look at the business case for digital adoption, this is something that, obviously you see my curve on the right-hand side, and a lot of us have talked about these curves in the past and historically for digital adoption over even the last 30, 40 years in the way that digital and AI have been used within organizations. But what I'm talking about here is when you're looking at adopting technology within an organization, obviously you have everything from your innovators all the way through to your late adopters. But in determining the business case and being able to set yourself up to measure for ROI and for benefit gain within an organization, the first and primary thing you need to do is determine your goal or goals with your digital adoption. And this is really important because, again, you need to be able to set benchmarks and go back and measure against that success, not only for your own internal use, and to be able to retool and re-justify and revalidate the investment that you're making in digital, but also because you want to be able to go back and show those gains and those operational efficiencies in addition to the hard dollars. So some of the more common goals in deploying digital today are obviously faster primary diagnosis, expanding your outreach or increasing your outreach business. Competitive advantage is becoming a big one. So as laboratories are becoming more and more digital, maintaining or gaining a competitive advantage against those who are not is a key goal. Even just staying current with the technology that's available in the industry. Again, digital is becoming mainstream. It is the current technology that's available. So staying up to date on current technology is another goal. Education, training, competency evaluations. So for digital pathology platforms that deploy educational components or modules, these are key benefits and goals that you can set within your organization to be able to support not only onboarding or, if you're a teaching institution, residents and resident training, but also competency training for your existing pathologists. And that can be all the way down to credentialing and credential management for regulatory bodies, et cetera. But then also to leverage resource efficiency. And this goes to your whole operational efficiency gains. Once you've determined what your goals are and you are either entering the digital deployment phase or you're actually in a deployment phase, and if you've already begun, it's not too late to start if you haven't done this, set benchmarks. So understand and capture your measurements today prior to being digital. Measure your current turnaround times and do that for all case types and use cases within your organization, because as we all know, those can vary greatly. Actually capture what the cost of your shipping and your couriers are today, so you know what those hard dollars are. And when you're capturing those, be sure to include all the ancillary activities that go with that. So the cost of the employees, the cost of the actual packaging, not just the actual cost of the shipping and the couriers. And then keep in mind and keep track of what your current loss or breakage rates are too when you're doing shipping, because we all know there's a large cost that can trickle down from those. Check and track your corrected and amended reports and what those reasons are. Now, this doesn't have to be detailed in terms of the reasons. We're not looking to point fingers. But if you have categories of activities for reasons or percentages that you can apply to corrected and amended reports, these are things that you can go back and you can measure and you can level set against the efficiency gains and the accuracy gains by deploying digital. Consultations, so whether you do inbound or outbound consultations, measure those and the time frames that each of those take, because those obviously can have different time frames as well, internal and external. But not only that, keep in mind the tracking of glass that you're sending out, the tracking of the glass coming back in. How long does it actually take from the time you send a case out till the time you receive those results back from a consult, and vice versa if it's an internal consult. And employee satisfaction, measure employee satisfaction today. So employees' perceived satisfaction, in addition to their future satisfaction. So what are they looking for? Are they looking to be part of a forward-thinking and innovative company? And when we're talking about existing pathologists, also measure their satisfaction with their office ergonomics, because that is something that we hear and get feedback on once you've deployed digital as well. And then measure, measure, measure. So keep in mind that once you deploy digital, you're going to be measuring your results against what your original goals were and the original benchmarks, and that's going to help determine some of that ROI as well. And then when we look at integrating artificial intelligence and image analysis within a digital pathology platform, there's some key categories for areas of efficiency gains and actual dollar realization. On the left-hand side under key benefits, these I'm really focusing on. These are more geared towards general digital pathology deployment. So actual dollars saved, cost savings, and again, reduction in shipping costs and all the ancillary activities and employees associated with that. Efficiency gains. So again, faster turnaround times by deploying digital, being able to provide remote pathologists with cases same day by going digital. Streamlined and single workflows for pathologists, not having to work in multiple different systems or look through files and go into multiple different applications, to be able to have access to all of the information that they need at their fingertips about that patient in that case. And again, deploying current technology and having a technology base that is not only current and innovative, but when we look at deploying digital, we're still in the infancy for using this for pathology and for healthcare. This is really the foundation of where the industry and the technology and the technological capabilities are going to continue to expand and grow for the next 30, 40 years. So having an entry point here with a solid foundation, with an organization that really thinks about the fact that this needs to be architected to scale in ways we can't even imagine today for a decade or 2 decades or a quarter of a century from now is key. And then growth. So another obvious benefit of deploying digital is growth. And so being able to increase, again, your outreach business. So digital lends itself extremely well to supporting TC, to supporting PC, and even global for other organizations, global case types. If you have a vendor or a solution that is a web-based platform, then you have the ability to provide access to pathologists literally globally 24/7 through secure access to that platform. And think about how that expands your capabilities and growth as an organization, literally removing geographies and time zones. Then I look more on the right-hand side to deploying AI and image analysis within that platform. And when we talk about that, I'm not talking about AI and image analysis here as it relates to diagnostic aids. What I'm talking about is AI and image analysis that's geared towards enhancing and improving workflow and operational efficiencies. So being able to do things like auto orientation, region of interest registration, synchronized image viewing, triaging and automatically routing cases based on a variety of different factors, everything from complexity to urgency, whether it's as simple as understanding that this case was accessioned as a stat case, or whether it's an algorithm or image analysis that's able to identify that there's a higher propensity for a positive case or a complexly positive case that needs to get higher in a work list for a pathologist, and also by subspecialty again. And then when we talk about digital pathology and integrated workflows, again, this is key to interoperability, and I'm going to touch on that a little bit in here too, in terms of really realizing the benefits of digital. So again, we go to actual dollar savings and cost reductions. So being able to support remote locations. And if these are remote locations within your organizational structure, that's great. But keep in mind, and this is going to be on the right-hand side under increased business, also being able to support remote locations for competitive, I'll call it organizations or infrastructures. So when we think about pathologists and supporting remote locations, you've got either remote locations that get a pathologist 1 day a week or half a day a week even, or pathologists spending extremely valuable windshield commuter time where they're not actually leveraging and the organization isn't leveraging the benefit of their medical knowledge. That's just wasted time. By being able to support digital, you can now, or by deploying digital, you can support remote locations with a pathologist full-time, 5-7 days a week, whatever your business cycle is. Again, the reduction in shipping and couriers, but also being able to provide open and instant access for sharing, collaboration, and teaching environments. And then there's the ease of working with both internal and external education centers. So when you talk about being able to take cases, interesting cases in a clinical environment, being able to automatically anonymize those and send them out as teaching lists or as course content to be able to work with, again, if you're a teaching institution or you've got residents in training, being able to work with them. But then also if you're associated with academic centers, being able to say, hey, this would be a great course if you have, maybe you're an adjunct professor, or maybe you have a colleague who is, so you say, hey, this would be a great course for you, and being able to send that information out. And then when we talk about pathologist efficiency gains based upon simply the reduction in paperwork, files, sticky notes, markers, wax markers, etc. And then also being able to work in a single streamlined environment instead of having to go to different locations, whether it's paper or application or multiple combined, in order to find the full 360-degree view of this patient, is a significant time savings. And I remember seeing a study, and it may have been the LabPOM study, I'm not 100% sure, where they said that they saw a 40% efficiency gain alone just from reducing all of that extraneous work that a pathologist has to do, and just having the pathologist be able to focus on the interpretation and diagnosis of that case with everything at their fingertips. And then again, reducing transcriptionist and admin time, and of course the human errors that can be associated with that. But again, when we think about this employment environment and the inability or the difficulty in being able to hire staff and have fully staffed facilities, this can be significant in helping to offset that if you have, again, turnover in staff, if you're not able to fully staff all of your positions, and or if you have people who are out sick supporting family members, especially in times of a pandemic, that can be significant. And then in terms of the increased business, so again, being able to expand your geography with no additional infrastructure cost is significant. There's no need for brick and mortar or microscopes or anything else in order to expand your business geographically. Again, adding regional and rural facilities, whether it's additional ones or whether it's internal, but then also being able to provide services to underserved or accessibly challenged populations. This is a significant benefit of digital that certainly a lot of philanthropic organizations are looking at. And I think it's an area that a lot of hospitals and clinics in rural settings are often challenged with. And I think this is a huge lift that digital can provide to these populations. And then replacing your locum tenens, traveling pathologists, et cetera, is another benefit. And not only operational benefit, but has hard dollars associated with it as well. So when I look at, again, looking at your hard dollars and or your EDA benefits, lower shipping costs, increased business, but then also an image bank. So whole slide images, digital images, and digital pathology systems and AI algorithms carry this wealth of information with them, not only in the images themselves, but also in all of the metadata that's associated with that. So when you think of some of the benefits of this, not only as it relates to personalized medicine and computational medicine, but when you think about being able to provide an image bank as an additional source of revenue. So this is something that a lot of organizations are starting to realize can be a source of gold within their organization, and again, as an additional source of revenue. There are vendors who are looking for this information to be able to develop and validate their AI models. You're able to also, if you think about it, if you have scanners in-house, and you're not leveraging all of the time for those scanners, you could provide outsourced scanning services for local laboratories and other facilities within your neighborhood, or even through shipping and courier services, which obviously we're trying to get away from, but as an increased source of revenue for your organization and to help offset the cost of those scanners and that hardware. Again, on the EDA side, we have increased volumes. So when you look at being able to have a significant efficiency gain, you're able to do more capacity with the same resources. Or if you flip that and you say, we all talk about the looming and the current pathologist shortage, with pathologists who are aging out, who are retiring, with the lack of new ones call it new blood, coming into the industry and specializing in pathology, being able to maintain your current volumes with less resources. These are things that are significant. And even better, and I think this is one of the biggest gains for digital for us as an industry, is that as these pathologists with this wealth of knowledge and decades of experience are leaving, they have the ability to be able to keep their finger in the pie, so to speak. So they go to their beach house or their lake house or their mountain house to retire, and they can still read remotely 1 day a week or 1 week a month, or even utilize their knowledge and expertise to train the upcoming residents. And you think about the value that provides to an organization to not have to lose that wealth of knowledge that is potentially leaving, not just your organization or our organizations, but our industry. Higher accuracy. So improved accuracy leads to better patient safety, less corrected and amended reports, which we all know are a key measurement of success for an organization. And then faster turnaround times. So not only are you meeting your turnaround times, but by providing faster turnaround times, you have better client satisfaction. And satisfied clients do two things. One, they stay with your organization. They don't need to go to your competitors or your competition, but they also provide happy resources, which and references to be able to gain and increase your business with other customers. Okay, so looking at the measurement of success, is it ROI in terms of hard dollars? Is it benefits in terms of EDA? Is it a combination of the two? Well, when we look at the different categories and applying those benefits, really, several years ago, I kept hearing, well, we can't justify this investment. It's expensive to buy the hardware. It's expensive to buy and implement and support the software. But when you start looking at, there are now measurements and metrics of the hard dollars and the EDA, and the combination of the two that are being gained by organizations. So obviously digital provides for borderless implementation and medicine practice of pathology, speed in the diagnosis and treatment. That is extremely valuable. Obviously, it impacts the outcomes and the potential outcomes for patients directly. Better workflow management and speeds from an operational efficiency perspective, and that can tie to direct dollar savings. Remote access. So another source of revenue that we're hearing about and that people are starting to talk about is for the pathologist to be directly involved in the conversation with the patient. So telepathology with patients, being able to show them their images, show them their tumors, show them their cancer, and have that dialogue and conversation with them. And for PC, for the professional component work, I've heard this referred to as the Uber of pathology. So having access to specialists globally who can do the PC work for your organization. Accuracy, efficiency, and cost savings. So again, these metrics and these studies are coming back in, and what we're seeing is an average of 5 to 7 minutes per case savings by just using digital. That's not incorporating AI, that's just going digital. Access to education and research, better clinical trials, or even more specific, better identification of patients for specific clinical trials. Universal technology integration, and I want to stress this, laboratories, medical directors, pathologists, we need your help with this. So it is key when you are talking to your vendors to make sure that they are using interoperability. And when I say using interoperability, I mean from a mindset, from a business perspective, from a playing in an open environment with other vendors, to be able to provide and leverage the true value of digital, which is unlimited data access, right? It's key and crucial to have that real-time data exchange in order to truly leverage the benefits. And it doesn't benefit anyone to withhold that information. So interoperability. MSK, hi, Dr. Joe. MSK has said that 10% of their consults become patients. And so again, this is organic growth for your organization by increasing your consultation capabilities. And 1 billion new biopsy images are in the US annually right now. 1 billion. Think about that in terms of numbers. And then another metric I'll give you. So by 2030, and this started in 2020, to be honest, so it was a 10-year range, the prediction is that there will be 22 million new cancer diagnoses. That's a 50% increase over today. And again, we're talking about the looming pathologist shortage. So again, efficiency gains everywhere is a significant benefit. when you incorporate AI and IA, and I want to be sensitive to time, when you incorporate IA and AI, you obviously the speeding of diagnosis, treatment, training and education, QA and validation, that, we all hear read twice, get paid once. That's a great application of AI. And then doing things that a computer does much better than a human. So, detection and counting, segmentation, driving a pathologist to a region of interest, biomarker identification, computational pathology. All these things are things that a computer can do quickly and easily and provide the pathologist the ability to focus on what they do and they know, which is the medicine. I think we're running low on time, so I want to make sure that I leave enough time in here. But again, going into, pathologist job satisfaction, and all of this increases revenue and efficiency gains. So in summary, digital pathology streamlines workflow, increases efficiency, accuracy, and turnaround times. It is necessary for AI and image analysis. We all know you need digitized images to perform IA and AI. And digital pathology combined with AI and image analysis speeds the time to a specific and accurate diagnosis for a patient, which improves their outcomes.
Wanted to say thank you. I know we're a little bit at time. I just wanted to make a couple comments. I don't see anything in the chat, but put some references on operational efficiency, some publications that are out there. But I totally agree with you. I'm going to just speak personally. I had the chance, my fellow called in sick, and I basically sent out the stuff digitally a day ahead. That's an example of turnaround time just being all the biopsies done a day ahead because I didn't have the fellow in the loop. And these are just examples that you get around. So turnaround time, we were able to show that our resections were down by a third in terms of turnaround time. We actually cut it by a day in terms of actually having digital. So there's a lot of these things that are there, and we have a lot of people in the call that are very much trying to make the case to the C-suites. And I think what you provided was really valuable information. So
thank you.
Yeah.
Thank you.
Mike, I don't know if you had any questions too. I know we're running short on time.
Yeah, I think I think we're still discovering sweet spots. The value to the individual pathologist. I don't know how to quantitate this, but the freedom and flexibility to work where you want, when you want, how you want. Younger pathologists really value that. When you're juggling young kids and yeah, knock out a couple of hours, get the kids off to school, then come in, get out early so you can be home for them, and knock some stuff out later.
Yeah, the work-life balance is really, it's made a difference, especially for us.
That's appealing, right? I
Yeah.
mean,
Considering the shortage too, you have to consider the generations getting younger for pathologists. So this is the mindset, there's a shortage. If you do not offer this as an employer, I mentioned this too before, you don't, as it goes on, you don't offer this as an employer, you're going to be cut out, even if you pay a little bit higher. They may consider, my work-life balance is important to me. I will go to another place because it will provide me that.
Yeah.
That's key. True.
Yeah.
And again, employee satisfaction and employee retention, knowledge retention, that's important.
Oh, there's one question. We'll fit this in maybe one more minute. How do you predict state licensure for practice will change so we can practice for different locations? That's a hard one. That's a hard one.
Let me get my crystal ball.
Yeah,
yeah. I wish I could predict that. I can tell you, as a member of the API and also having colleagues that work closely with the DPA, we are working hard to petition for that. And I do think it's just a matter of education and time. I mean, the industry is pushing, the associations who support pathology and pathologists are pushing. It's just a matter of getting the regulatory bodies to understand the value and the safety of using digital and AI.
I was going to say the American Telemedicine Association. There's a lot of other organizations interested in this. It's also state licensure thing as well. You can see some of the more underserved states being much more open, while some of the more overserved states may be much more restrictive. But it's state by state, and that's just the nature of our laws in the United States. But it's a very important question. I guess I'm getting the hook. So,
Okay.
so
Well, thank you, everyone. It was
Thank
great
you,
great
everybody.
to see you guys.
And we'll be back in a couple of like 5 minutes for our next session. This is very timely because we're talking about business use cases again. So, all right.
Thank you.
Thanks. Bye.